Your Eminence, Excellencies, I'm sorry I'm not able to join you in person for this important meeting. The recent reports of new cases of the Mpox virus in Europe serve as a timely reminder that we are still in the throes of a deadly public health emergency of international concern. It brings clearly to life those memories we have of the last pandemic, the loved ones we lost, and the destruction that it wreaked. And it also begs the question, have we learned anything from the pandemic that will make us collectively safer in future? COVID-19 was a wake-up call for the world. Its impacts spread beyond human health to test the strength of global solidarity itself, as wealthier countries with the means to buy vaccines raced to secure the earliest supplies and left those without waiting in the line. As a lead of COVAX, the global mechanism to secure equitable access to COVID-19 vaccines, Gavi, the organization I lead today, fought hard to address this. Despite lacking the financial means at the outset of the pandemic to procure vaccines, it nevertheless succeeded by the end of 2022 in delivering nearly 2 billion vaccines to over 140 countries, the vast majority being lower-income countries. I joined Gavi in March 2024, and I'm humbled that the organization I lead today played a key role in arguably the most successful emergency health response in history. I'm also proud to say that since I joined in March this year, I have seen firsthand how efforts to translate the key learnings from COVID-19 are being translated into concrete actions that will serve humanity in future pandemics. We know that to achieve true vaccine equity in future emergencies, we need to ensure that affected countries have the means to purchase vaccines the moment an emergency occurs. This is what wealthy countries were able to do during COVID-19, even though at the time they could not be certain that vaccines would be effective. In the longer term, vaccine supply security and vaccine equity also depends on every region in the world having the capability to manufacture its own vaccines. Between 2001 and 2022, Gavi was able to increase the number of manufacturers of Gavi-supported vaccines from 5 to 19. But one region, Africa, still had very little vaccine manufacturing capacity at the time COVID-19 hit, leaving the region at the back of the line for vaccine access. Using money left over from renegotiating COVID-19 vaccine contracts, Gavi has innovated to address both of these challenges. And this brings me back to Mpox. When Africa declared Mpox a continental and international health emergency in August, one of the first actions we took at Gavi was to activate a new financial instrument, the First Response Fund, for the very first time. The First Response Fund is designed to provide rapid access, within 50 days, to fund the purchase and delivery of vaccines in the event of a health emergency. Using the fund, which was approved by our board in June this year, Gavi was able to place an order for 500,000 vaccines just over 1 month after the declaration of the Mpox emergency, making it the first direct procurement of Mpox vaccines related to the global response effort. It is one thing helping countries and regions rapidly access vaccines during health emergencies. It is another altogether helping them to put in place long-term measures so that in future they are able to make the vaccines themselves. In June this year, Gavi launched the African Vaccine Manufacturing Accelerator. This instrument, which we call AVMA for short, will make up to $1.2 billion of catalytic funding available over the next 10 years to support manufacturers in Africa as they scale up production. In this way, it supports the African Union's bold target of procuring 60% of its vaccine demand from within its own borders by 2040. AVMA is a crucial part of a broader collaborative effort to strengthen the research, development, and manufacturing of vaccines, with notable and complementary initiatives by the World Health Organization, the G20, CEPI, and the African Union either planned or already underway. Of course, these efforts alone are not enough. Many low-income countries in Africa and elsewhere require support to strengthen their health systems, and their systems for vaccine delivery in particular. That is why protecting the world, protecting people, and protecting communities are at the heart of Gavi's strategy for our next strategic period, which will run from 2026 to 2030. If we are able to secure the funding we seek, this strategy will not only enable Gavi to vaccinate more than 500 million children and avert 8 million preventable deaths in the process, it will enable Gavi to undertake its largest expansion of vaccine programs to prevent outbreak-prone diseases. Crucially, it will enable Gavi's largest ever investment in strategic vaccine stockpiles against diseases like Ebola, cholera, yellow fever, and Mpox. Back in 2006, Gavi introduced yet another groundbreaking innovation. Looking for a way to accelerate our access to capital, we launched the first of what have since become known as vaccine bonds. These are debt instruments backed by sovereign governments and targeted at institutional investors keen to generate social impact through their investing. The very first of these bonds was purchased by Pope Benedict XVI. Your Eminence, Your Excellencies, we were grateful to your support then, and I'm grateful to you today for inviting me to this important meeting and for the leading role the Church continues to play in support of the Mpox response and other health emergencies. I hope that we can count on the Church as an ally as we seek the sustainable funding for immunization required to bring the Sustainable Development Goals within reach and make the world a safer, more equitable place. I wish you a very successful meeting, and I thank you.